So your transverse abdominal muscle is such an important muscle to work before, during, and after pregnancy because it is a great stabilizing muscle for your core and your pelvic floor, and it'll help you recover a lot faster, and it'll help you prevent getting a larger than normal diastasis recti after pregnancy, postpartum. So if you don't know how to engage it now, then work on it during your pregnancy, so after you can jump on it and continue to gain strength postpartum. So the transverse abdominal is a core stabilizer muscle, and it kind of wraps up your entire core like a corset muscle. And to engage it, we call it a TA hug, or a transverse abdominal hug. And when you're pregnant, it almost feels like you're hugging your baby as you're engaging this muscle. So it may be hard to feel at first, but just keep practicing and you'll get there. But think about starting from the bottom and think about pulling your hip bones together or hugging your baby up from the bottom. And then as that muscle starts firing more, you'll start to feel it grab all the way up and hug your entire baby, your entire belly. So here is a quick, just a little hug, little hug, little hug. Okay, so that's a quick engagement. That's using your fast twitch muscles, right? We want to work on those too, because those are the ones that we use when we're getting up out of bed, right? You roll to your side, push with your arm, engage your transverse, get up out of bed. When you're standing up out of the chair, before you stand up, engage the transverse and your kegel if you can, and stand up. When you're going to pick something up as you stand up, engage that transverse, okay? So we can use it in that way, or we can also work the slow twitch muscles, which are where we hold that transverse abdominal hug, which is important too. So you can do that with your breath, and you'll see that in many of the exercises in my program too, is you'll take your breath, and then you'll do the transverse abdominal hug, and you should be able to hold it and still breathe and still talk, and then release it. And that's working the slow twitch muscles. So you want to make sure that you work both the quick, fast twitch and the slow twitch, where you can hold and talk and breathe. And then with that, you want to be able to engage your pelvic floor. So when you do these quick movements throughout your daily life, or these, as you're exercising, you can keep your core strong and your pelvic floor strong as well, so that you don't hurt yourself when you're pregnant, and so that you don't hurt yourself for after, right? Because sometimes a lot of the things we do during pregnancy can cause problems after, right? If we don't engage the abdominal as we sit up, we allow the abdominals to cone. You could see that in one of my other videos. And that puts a lot of pressure on that linea alba, which causes the rectus abdominal to split further than it needs to, and has a hard time recovering after birth. So engaging the transverse will allow that coning not to happen, and it'll just protect your core and protect all those ligaments and myofascial tissue in there that are supporting the pelvic floor and the core as well. So TA hug is hugging your baby with those transverse abdominal muscles.